First of all, thank you for having me.
Of course.
And so my background, I actually was born and raised in Jerusalem, the Holy Land. Growing up there, I went to school. We got really good education, I would say. And my father was a doctor. So I kind of knew early on that I wanted to be a physician. And as opposed to my father, who's really smart but doesn't like to work with his hands, I was the complete opposite. I wouldn't say I'm the smartest guy, but I like to work with my hands. So I wanted to be a surgeon as well. I like technical things and working things out, so I was always the one that fixes things around the house. And that combines, of course, the knowledge of biology and anatomy, as biology as a kid, and eventually anatomy in the human body, and then also being a surgeon, you can get to work with your hands as well. And so that's how I knew I wanted to be a surgeon. From there, I went to medical school in Jordan. 6 years there, medical school was really good. Made a lot of good friends, still friends with them till this day. And from there, I went back to Jerusalem, did a surgery residency for 6 years. And then after that, I had done a 1 year of residency exchange at Mount Sinai, New York. So every year they select 2 people, and then they send them to Mount Sinai for a residency exchange program. So I was one of those 2. Did that. That was my first U.S. experience as a doctor, as a trainee. It was really good, eye-opening. Of course, first time living in the U.S. in Manhattan, a little bit of a shocker, you would say.
I would say, yeah.
And then after that, I literally 2 days later, I knew that I matched in fellowship in Orlando. So
Really?
2 days later, after coming here, I actually called my family, told them, you guys know how I talked about I'm going to be here for 1 year and I'm going to come back. Actually, looks like it's going to be 2 years and then I'm going to come back. They thought I had planned this, right? They're like, no way, you just found out. No, but no, I
Right.
actually did. So yeah, I went from New York to Orlando, did my fellowship here, was going to go back home and be a surgeon there. I had a job lined up. And then eventually, I liked it here. We talked with the guys, now my partners, and they told me, actually, once you stay, but I had to repeat 3 years of residency to get board certified. So I repeated 3 years of my residency in Dallas, Texas. Whole different experience there as well. It was really good. Made a lot of good friends and mentors there too. Different hospital system there. I got exposed to a lot of trauma. And
Right.
then I came back and here I am. So long journey, overtrained, I would say.
It sounds like it.
But you know what? It was really good. I learned along the way. I got exposed to different hospital systems. I got exposed to different surgeons, and I think that all opened up my horizons and made me a better surgeon.
You said you like to work with your hands. How did you find that out? Were there other activities that brought that out in you?
But I always like to do something, build something, and then look at it at the end of the day and say, oh, look what I made as well.
Right.
Sports activities, I actually grew up playing basketball. I wasn't very good at it. And somehow along the way, I switched to soccer. I'm not very good at it either, but I enjoy
That's right.
it.
I think I saw somewhere that you said you wanted to be a soccer coach.
I could
saw
be a
that somewhere.
coach. I can tell you exactly what the tactics should be and where every player should be. I'm not very good at doing it myself.
Are you Premier League? Do you like MLS? What do you all of it?
Italian league all the way.
Italian. Okay. All right. I know because I've met with you before. We've talked, and I've looked into your stuff that robots don't do your surgery for you. So, how do you explain robotics as a process to people that are interested in bariatric surgery for you?
Right, so robot is a misnomer, really, because you think about it, especially this day and age, AI is a big thing.
Right.
Artificial intelligence, and everybody's talking about that, a hot topic. So when you say a robot, you imagine a device that can do something on its own. We all see the movies. You see a human-like structure that walks on its own and builds something without you having to actually, do anything. The surgical robot is nowhere near that. It's not that at all. So what I explained, the analogy that I always use is a drone. Drones don't fly on their own, or at least not that I know of. And as a result, you need somebody that flies that on the ground. The only difference is that the pilot is actually not inside that device. So the same thing with the surgical robot. I have a console. I'm sitting there, literally a few feet away, and I control that robot, every move. So it's really just a device that I can control remotely. So what is the advantage of that? The advantage of that is really that it gives me three-dimensional visualization as opposed to the conventional laparoscopy, which is going to be two-dimensional. It also gives you articulating instruments to mimic the surgeon's movements better than conventional laparoscopy. With conventional laparoscopy, you get only a straight stick where you can move it in a certain direction, but you can't articulate like you're doing open surgery. So this does, and that means I can do more precise surgery with it, and as a result, potentially have better outcomes for the patients, safer surgery, easier recovery, so on and so forth.
So cost is more probably than not a consideration in these types of things. How does it look from an insurance standpoint with having these types of surgeries performed?
Right. So, as in robotic or as in bariatric?
Just bariatrics in general.
Yeah. So obviously, the cost of it can be quite costly to the insurance. However, most insurance companies do cover that for two reasons. First of all, you have to have the patient's best health in mind. And then second of all, they do know, or the majority of them do know, that while I can have diabetes, blood pressure, so on and so forth, it might be cheaper if we look at it just this year to pay for my medications rather than have the surgery. On the long term, if you look at it in a 20-year perspective or so, it's going to cost them much more money if I really stay overweight, need diabetes medication, blood pressure medication, cholesterol medications. It's going to cost them much more. I'm going to need a hospital to get admitted because my blood sugars are out of whack or so on. So it's cheaper for them to actually pay for my surgery today, have that go away, and then have better health in the long term.
Now, are they seeing it that way? Is that much of a battle to get them convinced of that? Or?
Some of them do and some of them don't. The issue that we see often is that some of them don't cover bariatrics because also there's another perspective of some insurance companies that most of the time they tell you in 5 years' time that patient would have switched insurance companies potentially, and then that wouldn't be my problem. So if they look at it at a pure financial standpoint, some of them have an issue with that, and that is something that we are trying to fix because it shouldn't be the case.
Right.
Because of point one that I mentioned a second ago.
Right.
The patient's health needs to take priority over your finances, right?
Right.
And so eventually, at the end of the day, us as a society, as a nation, having everybody also be healthier, live longer, and also financially, if they live up to the age of 80 plus, and they can work up to the age of 70 plus without having any issues, they're going to contribute more to the society financially, so on and so forth.
Which, these things should be their concern, right?
Exactly.
Sometimes you feel like you have to educate them on this process.
Unfortunately, sometimes it can be dicey.
Right. So, someone that's considering this as part of the process for, they're aware of bariatrics, they're interested in it, when should they engage with you? Like, what's the best time to get involved in this?
So that's an excellent question, and I would say as soon as possible. I cannot count on one hand, really, that the times that we go in, probably a month, and then it happens to all of us probably once a month or so, and we find a patient young, we thought was healthy, or they thought they were healthy and overweight. They delayed the surgery initially until they got convinced to do it, and then all of a sudden we find unexpected liver cirrhosis, for example, which is not reversible at that point. So if you are struggling with your weight, I would say just come in, have that conversation, marinate on the idea, hear about the different surgeries, how they work, think about it at least. You'll get enlightened. It's not going to cost you anything in that sense other than 1 hour of your time for that consultation, even if you don't proceed with it. But it's really going to get you through that door to see what options you have based on your weight, because some things can be reversible now, but they may not be 5 years down the road or 10 years down the road.
Travel healthcare.
Right. So we see, obviously, just working in Florida, living in Florida, a lot of patients that come in and fly in to have surgery with us, or the opposite, right? A lot of patients that go into other countries, mostly Mexico, to have their surgery done. I think that it's totally fine to fly in and have your surgery elsewhere, whether you're flying in to have it here with us or you're flying outside if you don't have insurance coverage and having it done outside, as long as you know that you have enough support once you go back. That's my biggest thing. What I do want you to make sure that either your surgeon can follow up with you virtually or set you up with somebody that can follow up with you in your hometown where you're going to be actually living. Because having the surgery and having that part done is the easy part that takes 1 hour, 2 hours, 3 hours, whatever procedure that you're going to have. But it's going to be really that long-term follow-up and holding yourself accountable and making sure your blood work looks good and so on and so forth that needs to keep you in check so for your successful 10 years down the road and not just losing weight for the first year and a half and then eventually completely gaining the weight back.
I mean, is this something that parents consider for their children? What have you seen with that?
It is something that definitely you can consider for adolescents as well. There is enough data and research to show that. And this is completely approved also for adolescents in the United States and endorsed by the governing body, the SMBS, for the governing body for bariatric surgeons as well. So if your children are suffering from weight issues as well, this is definitely something that we can consider. With children, it's a little bit different. Of course, you need to make sure that you have a pediatric center of excellence, which we do, but also you need to make sure that they don't have any underlying abnormalities that can be contributing to their obesity. Now, this is of course also the case with adults, but much less likely with adults that they're suffering from that as well.
What would you say to a parent that's considering it?
Come in, hear what the doctors have to say. You can even talk to your pediatrician about it, and I'm pretty sure they are also pretty aware of the dangers of obesity, and then just consider that option. You don't have to go that route immediately. Just think about it, listen about what they have to say as well.
What about the pediatric physician education? Are they aware of this stuff to the good point? Are you finding that there's enough of an education process out there for it so that people that are coming to you kind of understanding it better? Or?
I would say it's growing for sure. I would say more and more pediatric physicians and patients, honestly, and parents are more aware of it too. If you look at the whole process of, for example, what we call atherosclerosis, which is really the arteries getting hardened, which leads to heart attacks and blood pressure and strokes in the future, they used to think that this is something that takes a whole lot of time to form. And so being a little bit overweight when you're 13 years old doesn't have a whole lot of effect. Now we know that is absolutely not the case. It actually starts very early on. And so we're 13, 14-year-old, eating junk food, being overweight as well, they're already setting themselves up for failure to have that, high blood pressure, diabetes, high cholesterol already at an early age because of all of that. Now, a big part of it is something that I really annoys me personally is that whenever you go here, I would say, to any restaurant outside or even the hospital cafeteria for all that matter, and you look at the kids' menu, it tends to always be processed foods, highly rewarding foods that are not, the kids' menu, it's chicken tenders and fries with pizza. I don't know what that may be, right? And so there's nothing wrong with them eating those foods once in a while.
Right.
But that doesn't mean just because they're kids, that's all they can eat. They can eat fruits and vegetables just as much as we can. Probably should even do so more, right? High quality proteins as opposed to this processed food that they're getting their bodies used to, and so their brains now think, oh, this is what food should taste like. Their brains are basically getting this high reward from these highly processed foods, and now when you feed them something healthy, it's not going to trigger that reward system that they got used to, and as a result, they're not going to enjoy it. And it triggers this whole inflammatory response in their body that causes basically low-key inflammation in their body that can cause that atherosclerosis that we talked about, inflammation in all of their bodies, and as a result, predispose them to all of those medical conditions.
What would you say to someone who's considering surgery as a path for them? When I say that, I mean a surgical physician. What would you say to someone who's considering that as their pathway?
It is an excellent career choice, but you have to make sure that you're the right person for it. So I love it, but that doesn't mean that it's the right career choice for everybody. A lot of people tend to choose it just because they, see that exciting aspect of it where you do the surgery and everything, it looks exciting, and then that's what they want to do. But there's also, that means you have to learn how to deal with stress. You have to learn how to deal with your patient having an issue, which can absolutely happen in any field. It doesn't happen often with today's advances, but could happen as well. That means that you have to know how to function when you have had a long day and still give the patient 100% no matter what. I always say there are fields that you can be right only once in your lifetime, like in finance. If you get it right, time it right, the stock market only once in your lifetime, that's good enough. That means you're a genius, right?
Right.
There are fields that you can be right 70% of the time and you'll be excellent. I don't know if I can give an example of that, but I'm pretty sure you can think of one. And there are fields that you have to be absolutely spot on 100% of the time. Being a surgeon is one of them. Being a pilot is one of them, right?
Right.
A good
Not
pilot-
being the weatherman.
not being the weatherman. That's actually it's actually another example of that 70% of the time, right?
Right.
So
yeah.
being a pilot is one of them. You can't say, "Oh, I landed perfectly 80% of the time. 20% we crash. I'm pretty decent." No,
Right.
you can't. And so being a surgeon is just like that. You have to make everything look perfect 100% of the time, no matter what the conditions are. And you have to make sure that you're the right person for it.
Yeah.
And if you think that you are, it's a highly rewarding career. There's nothing better than doing surgery on somebody and then having them come back a month later and telling you my diabetes has gone away. I feel good. I can walk.